this is Dr. Michael Hibner from Arizona Center for Chronic Pelvic Pain. And after a short gap, the next episode of Questions That Need Answers with Dr. Michael Hibner. And today I'll be reading from your emails, both from patients in the United States and in Europe, and answering your questions. What can cause severe pain in the vulva, labia, and clitoris during the first and sometimes second day of menstruation and ovulation? The pain is severe and it occurs in standing and sitting positions. I have had 2 natural childbirths. During my second pregnancy, I developed varicose veins in my vulva and legs. And 2 months ago, I underwent an intrauterine microphlebectomy procedure, but the pain persists, and according to the vascular surgeon, it is not a vascular problem. So I do believe it's a vascular problem, except the engorged veins that are causing your pain are actually not located in the uterus where they were, where the veins were closed, but they are most likely present in the veins that run together with the dorsal clitoral nerve, which is the branch of the pudendal nerve which runs to the clitoris right here, and the enlarged vein that runs with a branch of the perineal nerve. Now, those are not visible on the outside. If you just look, you can't see them. But if you do the ultrasound, you can see the engorged veins in those areas. And those veins may get very, very engorged. They are so much bigger than the actual clitoral nerve or perineal nerve. So in the standing position and the sitting position, this is when those veins fill with blood, and they are compressing the nerves that innervate your labia, your vulva, and your clitoris. And of course, in a situation where you have tendency to have varicose veins in your legs, you're much more predisposed to those veins. So what you need is an ultrasound of your perineal area. You need those veins identified, and you need to have them sclerosed directly. Thank you.